Welcome to NCLEX in practice. Today, we're going to look at blood transfusion safety, specifically how verification errors happen and how to recognize a transfusion reaction fast. In 2016, a patient died after receiving the wrong blood type because a nurse skipped the two-nurse verification step to save time. That shortcut cost a life. Every step in the transfusion process exists for a reason, and the NCLEX will test whether you know when to act and when to stop the transfusion entirely. Here is your first scenario. A nurse is preparing to administer packed red blood cells. The unit is already hanging from the previous shift. The patient is awake and asking to start. The nurse checks the patient's armband against the blood bag label and finds the names match, but does not complete the full two-nurse verification because a second nurse is unavailable. What should the nurse do? Option A, begin the transfusion since the names match and the patient confirmed their identity verbally. Option B, wait and locate a second licensed nurse to complete the full verification before starting. Option C, call the provider for a verbal order to proceed without a second verifier. Option D, start the transfusion slowly and monitor closely for the first 15 minutes. Let's work through each option. Option A is incorrect. A name match alone is not enough. The full verification includes blood type, unit number, expiration date, and patient identification number. Skipping any part of this creates a direct risk of transfusing incompatible blood, which can be fatal within minutes. Option C is incorrect. A provider verbal order does not replace the safety protocol. The two-nurse verification is a facility policy and a patient safety standard, not something a provider can waive over the phone. Option D is incorrect. Starting slowly and monitoring does not reduce the risk of giving the wrong blood. If the unit is incompatible, the damage begins with the very first milliliters. The correct answer is option B. Wait and locate a second licensed nurse. No transfusion should begin without full verification completed by two licensed nurses. This is non-negotiable on the NCLEX and in real practice. Patient safety always comes before convenience or time pressure. Now here is your second scenario. A patient is 20 minutes into a blood transfusion when they report feeling warm and develop a sudden headache. Their blood pressure has dropped from 120/78 to 100/60. Their temperature has risen from 98.6 to 100.2 degrees Fahrenheit. What should the nurse do first? Option A, slow the transfusion rate and reassess in 15 minutes. Option B, administer acetaminophen for the fever and document the findings. Option C, stop the transfusion immediately. Keep the intravenous line open with normal saline and notify the provider. Option D, obtain a blood culture and wait for results before stopping the transfusion. Let's break this down. Option A is incorrect. Slowing the rate does not stop the reaction. If this is an acute hemolytic reaction, continuing the transfusion at any rate can cause kidney failure, shock, and death. The blood must stop. Option B is incorrect. Treating the fever without stopping the transfusion ignores the root cause. These symptoms together, warmth, headache, dropping blood pressure, and rising temperature, are classic early signs of a transfusion reaction, not a simple fever. Option D is incorrect. Waiting for lab results while the transfusion continues puts the patient in immediate danger. The NCLEX does not reward delayed action when a patient is showing signs of acute deterioration. The correct answer is option C. Stop the transfusion immediately, keep the line open with normal saline, and notify the provider. The moment you suspect a transfusion reaction, you stop the blood. You do not slow it, you do not wait, you stop it. Then you keep the intravenous line patent with normal saline using new tubing so the blood product does not continue to infuse. Notify the provider, stay with the patient, and prepare to send the blood bag and tubing to the lab. On the NCLEX, early recognition and immediate action are what separate a manageable reaction from a preventable death. See you next time on NCLEX in practice.